We have an update for you tonight on COVID-19 testing from one of the largest drugstore chains in the country, and it's based right here in Pennsylvania. Rite Aid has been doing self-swab tests, and initially there were concerns about their reliability, but Target 11 investigator Rick Earl spoke exclusively with the store's clinical manager, and they say they're getting reliable and quick results.
One of the big issues with testing is getting those results back in a timely manner. Tonight, Rite Aid says they're right on track with a turnaround time anywhere from 3 to 7 days. And they say the self-swab tests are proving to be just as reliable as those physician-administered tests.
They've committed some substantial resources specifically to our testing program to make sure we're getting these results out as fast as we can.
Rite Aid clinical manager Chris Altman says the lab responsible for analyzing every one of their COVID-19 tests had promised results in 2 to 7 days, and they've done just that.
The month of July, we saw about on average a 4-day turnaround for our results to come back.
Altman says every store also plays a vital role in getting the results back quickly.
We're doing everything we can so that as soon as that swab is taken, we get it out to the lab as fast as we can, because that's sometimes the rate limiting step, right? Just getting that sample that was collected from our Rite Aid store to the lab.
Quicker test results, health officials say, make it easier to conduct contact tracing and stop the spread of the virus. The drugstore chain based in Harrisburg has 260 testing sites nationwide. Each site has the capability to conduct 50 tests per day, and the chain is doing a total of about 8,000 tests every day.
We have some sites that are in more rural areas, so areas that just really don't have, we put it there to support the population that was there, but realistically, to get 50 people in every day, day after day, it's probably not enough people to support that. So we're at, particularly in our metro areas, we're at that capacity every day.
Rite Aid uses the self-administered COVID test. It allows them to do more tests even faster, and they say it's safer.
Letting the patient do it themselves enables our pharmacists, number one, protect themselves, but number two, we can do a lot more patients because we're not circulating through all that protective equipment every time someone new comes through. So we can actually really get people through a lot more quickly and efficiently with just the self-swab.
Early on in the pandemic, questions surfaced about the reliability of self-administered tests, and health officials around the country even issued warnings like this in San Antonio, Texas.
The self-tests are slightly less accurate than the health professional conducted tests. Generally speaking, we recommend you go to one of our sites where a health professional can administer the test, or go to your own private physician's office where they can do it.
But recent studies revealed that the self-administered tests are just as reliable as the deep probing nasopharyngeal test done by health professionals.
Initially, we thought you had to have a deep nasopharyngeal sample, but more recent studies have actually shown that self-administered nasal samples from the mid part of the nose are actually very accurate, up to 90% accurate.
And now the FDA has issued an emergency use authorization for a saliva test developed at Yale University. It's less expensive and less invasive, and some NBA players have been participating in a trial study.
We've been working closely with our lab because they're the ones who would have to validate the saliva testing. So it's definitely out there in the market. I don't know really to what degree people are electing to go down that path.
And while the drugstore chain has been focused on the coronavirus for the past 6 months, Rite Aid CEO recently issued a warning saying with the combination of COVID and the flu this fall, the health situation could be worrying, adding that they expect a significant surge in the need for flu shots.